Thank you so much, Mr. Watkins. Thank you to all of our panelists for giving such amazing introductions for yourselves. I will hand it over to Soror Ford to handle the rest of the discussion. I just want to remind everyone that you are able to send questions into the panelists through the chat throughout the course of their conversation.
Thank you so much. Okay, so I can't tell y'all how much joy this brings me to talk about my two favorite subjects, which is health and politics, in the same sitting, and to be the one to get to ask the questions instead of answering them. So this is a big treat for me. I did see one question pop up on the Zoom chat that was for me, and I'm gonna get mine out of the way so I can ask my questions. Someone asked about how long after exposure should you expect to have a positive test. Their exposure can be anywhere between 3 to 10 days, which is part of the problem. Are you hearing me okay? Because it sounds very muffly to me. Can somebody give me a thumbs up?
We're getting a little bit of a scratch.
Yeah, I don't know what that's all about.
But we can hear you talking.
Okay, okay. So that part of the problem right now nationwide is testing, either access to testing or the turnaround time for tests. We keep finding different vendors who promise us 24 hours, 48 hours, but right now our test results are coming back anywhere from 3 days to 9 days. And so when you're talking about social isolation and quarantine, that's a tough thing to manage with a test that takes that long to go about. So that's a long answer to that question. So now, Dr. Gracia, from a policy perspective, we're all knowing that we're going to see another wave of COVID-19 in the fall. And so what, from a policy perspective, can we do to sort of ward off some of these inequities that we're already seeing? Are there things that can be put in place timely enough to address the next surge of COVID-19?
Thanks for that question. It's absolutely right and is important. That a lot of discussion about the second wave, and not only a second wave, but also that coinciding with the flu season as well. And so really a grave concern with regards to the impact that will have on communities. I think there are things that we can put into place. And we, at Trust for America's Health, we're advocating for both short-term and long-term solutions that really need to be built upon. I think one, we need to recognize that we have to actually strengthen and bolster the public health infrastructure. Public health has been underfunded for decades, and so Ford, I know you know this very well,
yes.
that it's been underfunded. But in particular, for example, with regards to emergency response funding, there are two programs in particular: the Public Health Emergency Preparedness Grants and the Hospital Preparedness Grants, which enable states and localities to actually prepare for public health emergencies. And public health emergencies can be infectious disease outbreaks, or they can be weather-related emergencies like floods and hurricanes and other types of disasters. But both of these programs have seen cuts where they've been cut by the Hospital Preparedness Program, which enables hospitals to actually have that surge capacity to be able to care for more patients when you're actually dealing with these crises. It's been cut in half since the program was initiated. The Public Health Emergency Preparedness Program has been cut by a third, and this is a program that enables public health departments to hire the workforce that they need to do the contact tracing, to be able to do the laboratory surveillance. So the more that we can actually shore up and build up that capacity, even now, before we get into these second waves of COVID-19, will be critically important. And we have to make sure that seeing that how this has disproportionately impacted communities of color, which we have seen this with other emergencies, right? That there have been these disparities. Look at the H1N1 pandemic in 2009, or the Flint water crisis, or others. Ensuring that community leaders have a seat at the table and are working side by side with these departments and with other leaders to be able to prepare for and do the outreach and education, and ensure we actually have the testing, the capacity that's needed in communities.
Thank you so much. Okay, Mr. Watkins, $1 million question here. Joe Biden appears to be the front runner for the Democratic position for election. Now, you know, we hear in the Black community that, well, you know, my vote's not a guaranteed Democrat vote. You know, they shouldn't assume that we're all going to vote Democratic. Can you speak to that a little bit, especially in light of everything going on right now?
Well, and it's a great question, but when we think about the data, and for those of us, you know, because we come out of a community where, you know, we have to look at the facts, Black folks vote 90% for the progressive candidate. And when we start to parse it by gender, Black men vote around 88% to 90% for the progressive candidate. Black women are around 90 to 92% for the progressive candidate. Progressive in this country usually equals Democrat. And so fundamentally, what we struggle with is that we're playing in the margins. So I'm going to pick on Donald Trump for a second in the sense that he only needs about 12 to 13% of Black men to either vote for him, not vote at all, or to mess up their vote by going to vote and not pick somebody on the top of the ticket so that he can actually stay in office. Black women, he's written off because y'all know what to do. And statistically, there's probably no chance that you're going to get less than 90% of Black women to vote for a candidate who is not Donald Trump. The issue, though, becomes, and it's why we were having this conversation earlier with Dr. Daly and Siobhan, is how do we get Black women and Black men to own their seat of power? Because what happens is we get taken for granted. So when you hear the former vice president say he's going to pick a Black woman as his VP, there's a dichotomy there. Part of that is because he knows y'all are going to show up, deliver, and without y'all, he can't win. But the question becomes, what does the platform and the policy look like that invests in Black women holistically so that we in our communities are made whole? When you think about Black mothers who have to work and have children, you can't go back to work if you got 2 kids who have to be homeschooled and there's no daycare. How do you actually balance out the agenda in a way that normalizes the fact that your vote may be a locked-in vote, but it has to come with strings. It has to come with conditions. And so in many ways, we're wrestling with that reality because we all know that the man in the White House is not our friend, but we also want to make sure that the man who could occupy the White House in his place actually has policies that benefit each and every one of us.
I'm going to stick with you for a moment because there's a couple of questions coming from the chat room. One of them speaks to voter suppression and how do we address voter suppression? Hold on, I'm trying to scroll it up to see the whole question. There we go. How do we avoid voter suppression? Is it possible to get mail-in voting in all 50 states in time for the presidential election?
Whew, that's a big question and a big fight. So there's a couple of realities. I'll do 3 quick points. The first reality is that vote by mail is not something that is trusted by the majority of Black people, unfortunately. And that's a reality when you look at the great state of Mississippi, Alabama, Georgia. Absentee ballots, vote by mail, tampering with ballots have been historically a reality. Now, if you're in Oregon, vote by mail is the law of the land, the state of play. And so it's uneven when you think about the notion of vote by mail being a solution. What we have been advocating for, and I believe Senator Harris, Kamala Harris's bill is probably one of the best bills out there. It's a $5 billion package that basically says you got to have vote by mail, no fault absentee, early vote, at least 2 weeks. You have to have online voting options, meaning you can download your ballot and drop it off at a vote center. Basically, we got to make it so easy for eligible voters that you have a choice, because that's the only way you're going to get Black voters and voters in general to participate at a higher level when their lives could be at risk. And I point to that Wisconsin example that actually that was the greatest form of voter suppression. If you scare folks into thinking participating can risk your life, I know my grandmother's like, I'm not risking my life to vote for somebody who ain't me. So when you start to add up the connectivity around voter suppression, it really is about advocating for funding. And so the federal stimulus through the HEROES Act matters. It's also pushing your governor and your attorney general and your secretary of state, whether they're a Republican or a Democrat, because in the great state of Georgia, for example, Leader Stacey Abrams has made it clear that they don't want to invest in retrofitting and right-sizing the election standards in the election administration because that doesn't benefit Governor Kemp. He wins based upon keeping some folks at home who look like us. It may benefit Lucy McBath, but not him. And so it's a fight at the state and local level around funding. And when I see elected officials like Regina, for example, you all actually have a hyper-local voice that matters even more than what's happening on the Hill. And so how do we connect the dots and make sure that the advocacy on the ground, that there's outrage around testing, there's outrage around funding for education equipment for homes that have maybe one computer, not enough, but that there's outrage around the fact that the election administration in your state, your city, your county could be underfunded or not done in a way that's COVID-19 compliant. So it's a hyper-local fight, and there's not a one-size-fits-all, which is why we have to advocate and ask for everything, because each state and each administration is very different.
Thank you. Okay, we're here till the half hour, correct? Because there's some great questions on here, and I just want to make sure I get everybody's. Yes, Morgan? When do we shut down?
Sorry. Okay. 8.
4 minutes from now?
That is, Seneca, is there a different time? Or is it 8?
Oh, I don't think we set like an end, or at least in my mind, I didn't set an end time. So,
well, now we have to have an end.
I think as long as people want to stay and talk, should be fun.
Well, okay, I've got three good hot questions here coming. So I'm going to be selfish. So you spoke about trust, Mr. Watkins, and I'm going to bring Dr. Gracia back about trust again, because you mentioned a vaccine. Now, we can't get folks to take the flu vaccine every year that's been out forever. So what is our expectation for the most vulnerable among us, people of color, even taking a COVID-19 vaccine once it becomes available? What are your thoughts about that?
It's an important concern. Before working at Trust for America's Health, I was in federal government. I was in the Obama administration as director of the Office of Minority Health at the U.S. Department of Health and Human Services. And we worked a great deal on the issue of flu vaccination, but vaccination in general, in communities of color, in underserved communities. And part of what we did and what we are doing now is really advocating that, one, in addition to having just the infrastructure, there needs to be efforts to really ensure that we are educating, that we are partnering with communities and using trusted leaders and members in communities. Jamal talked about that in his presentation, and also highlighted Soror Wallace-Jones, who as an elected official can be a trusted voice in communities to be able to get the message out. But this has been a long-standing issue, and it's one that we are significantly concerned about. It's how do you work with, for example, faith-based organizations, churches? How do you work with community health workers? How do you work with other institutions that are trusted in communities, and really not only ask them to help, but give them the resources as well to be able to provide that type of outreach and education? We found some successes with that in our flu vaccine campaigns when I was working at the U.S. Department of Health and Human Services, but we know that this is going to be a challenge. And so we have to get started now and not wait until the vaccine is actually ready to be able to do that outreach, because there is distrust. And that distrust is founded on things such as bias that we know has existed in the healthcare delivery system, a lack of access, and concern about is the vaccine safe and effective? And so really using trusted messengers who are giving messages in a culturally appropriate way, in a linguistically appropriate way, who really have longstanding established relationships, and not to think that we can come in as individuals who may be strangers to the community to convince the community about getting the vaccine.
Thank you. So what may be the final question is that I'm going to actually combine them because they're related. It's about sending your children back to school and college. What are some tips that we should be thinking about? And that was to me. And also just a mental health question, which is a very valid question. Once you've been socially isolated for this long, there's a lot of anxiety about being back out into the community. And as parents, how do we slowly introduce our children out of that tight bubble that they've been in for the last 8 to 10 weeks? And so those are related questions. And I would just say, as we start to reduce social distancing, it still has to be gradual. My state has been very open about loosening guidelines pretty dramatically. And some of us in the public health field are a little concerned about that. What I tell people is just because you can do something doesn't mean you should do something. And so introduction, quote unquote, back into society should still be somewhat gradual. So, you know, including maybe one family to begin with, and then slowly expanding your circle slowly so that when people like me try to do contact investigations, it's not so tough to know who all you were exposed to. And so it would have to be a slow, gradual exposure to other people, still being mindful of masks and gloves and wiping down surfaces and some reasonable level of social distancing, although that's going to be a challenge as school starts. And we've had so many discussions with school systems because this is extremely complicated. College students are actually a little easier to manage because of the dorm situation and the ability to isolate somewhat. We could have one whole dorm that might be the isolation and quarantine dorm should that become necessary. And there's still some options for reasonable social distancing. You talk about pre-K kids, it's impossible to keep them apart. And so there's been so many discussions, even to take it down to even transportation, a school bus. If you socially distance as guidelines suggest on a school bus, that's only 12 kids on a school bus, which means somebody's gonna be standing at the bus stop at 5 o'clock in the morning if you wanna get everybody to school on time. And so these are all the things that we have to think about. There have been so many recommendations of trying to have school hallways be unidirectional. These are people clearly who don't have children, who don't understand that children don't follow these types of guidelines. And so it's going to be a challenge. And I think there's going to be a lot of missteps as we try to figure this out. It's a tough discussion because parents are so frustrated trying to homeschool kids right now. And so there's a population that are ready for their children to be back at school. And then there's a population that are extremely anxious. If you are a person sending your child back to school, what you need to be asking them is, have they created a written plan for what that looks like in terms of transportation, in terms of meal deliveries, lunch service? How does that look in terms of classroom spacing? What kinds of sanitization did they do over the summer? What kinds of precautions are they continuing to do? Restrooms are a huge issue in schools on a regular day. What are they doing to monitor these types of things? As a parent, what can you do to support them? If that means donating a big jar of hand sanitizer, then that's fine. It certainly means not sending your child to school sick, because that happens a lot. And be prepared to take your child back home if they identify them as being febrile, because probably what's going to happen is that all children are going to be screened at the door for fever. And if they are found to be either symptomatic or they have a temperature, they're going to be sent home. And so parents can't say, well, I can't come get them, I have to, work or whatever. So there's going to have to be flexibility on both sides. But those are just some of the basic questions. In terms of a dorm, you want to know what they're doing in terms of separating individuals. We all lived on campus at Stanford. We know how close those rooms are. I mean, there's only so much social distancing you can do when you can literally reach out and touch the other person on the bunk below you. And so the school systems are going to have to figure out how much spacing is adequate to allow them to operate school in a way that makes people feel safe. So these are just some of the questions as parents. My son's in college as well, that I'm certainly asking them for the fall, but I'm also prepared for some online learning until they work some of these things out. Let me shoot down here some more. There's some great stuff on here in terms of some links for you all to check. We talked about how long after exposure can show us positive. We did answer that question. So I think that's it in terms of questions from the floor. I wanted to just ask, which may sound like a very simple question for Mr. Watkins, but it just baffles me why, in light of, even despite any kind of, if you even take out the racial issues and things along that line, why a president who has had such a dreadful response to a life-threatening pandemic would have such a high approval rate in the midst of this crisis? What are your thoughts about that?
You know, that's a loaded question, and I'm going to approach it from a different angle to get to the answer. For the folks who I can see on the screen, Rhonda, Vaughn, you know, Darlene, Kim, I want all of you, raise your hand if you are able to work from home. And just keep it up for me. Just do this exercise with me. Keep it raised if you can get your groceries delivered. Instacart, Amazon Prime, Amazon Fresh. Raise your hand if you still have a job. The irony, you can put your hand down, the irony of the reality that we're experiencing in this moment is the majority of Americans can't raise their hand to those questions. So the people who are delivering your groceries, the people who are packing the food that you order from Amazon Fresh, all of that ecosystem and that infrastructure, they're essential workers. And you heard Dr. Gracia talk about it, but they're not considered frontline workers. And it's an economics issue. And so a lot of those folks who keep us safe at home and comfortable at home are a part of a working class that completely gets ignored. And so what's happened in this country, and I believe in politics, is that what the man in the White House, not going to call him president, has done is he's used race to divide us. So you got all these working people who right now have to go and work at Kroger. They have to drive the trucks. They have to drive the buses. And in many ways, they're looking at Black folks and brown folks and saying, it's your fault. It's you. But the reality is there's an economic machinery, the wealthy few, who are controlling that narrative and controlling that space and keeping us divided and fighting one another. So I would argue we are dealing with old school racism and class divisions. And in this moment, unfortunately, some of us are the privileged few who can see past that and actually can bridge the gap and understand that, wait a minute, there are some essential workers who literally last year we were saying shouldn't make $15 an hour because that's too much money. Now we're saying you got to go to work because guess what? I need my Amazon Prime. I need my Amazon Fresh. So when we think about the politics of this nation, you know, folks will say, oh, the NAACP, you're not needed anymore. But when I turn on the news and I see someone's, you know, neck being crushed, unfortunately, and then they die, and it's police brutality, and folks are still debating about it, we're still living in a very racist environment. And so folks like Donald Trump, in my opinion, are using that not because he wants to, you know, purify the country, but because he wants to stay in power and stay rich. And so in many ways, how do we dismantle sort of capitalism and racism in a way that's systematic so that more people, if there was a pandemic, can raise their hands and say, I can stay at home, work at home, be safe at home, and not have to go and be exposed to, you know, God knows what, because the powers that be are willing to do whatever they can to stay in power and to stay wealthy.
Thank you. One more question. If we're able to have our healthy college student or child tested before school starts, should we? Absolutely. With the precaution that a test is a point in time. So your negative test today is just a negative test today. It will not speak to your risk for exposure once you hit campus or once you hit the classroom, but it does give you some, at least a baseline sense of what your status is at that point. So I recommend everyone be tested. And I was very happy when the guidelines around testing were relaxed so that anyone could be able to receive a test. Another question, at the local level, what does Mr. Watkins recommend we do tomorrow to support the NAACP? And I bet I could probably answer this myself, but I'll let you take it. Join!
Well, I just put it in the chat. At the end of the day, you know, I'm not here to plug my organization, but I'm here to plug activism. So, you know, for those of us who are part of the Greek community, you have social action chairs. If you haven't connected to your social action chair lately, then I ask you right now, text, call, email Siobhan, Rhonda, AKAs, you can call Roz Brock. We all have somebody that's out there helping to set up what our advocacy looks like. And so if you're not a part of being active, and activism can take many forms. It can be that you simply say, tomorrow, I'm gonna call my senator and say, look, you need to pass the HEROES Act no matter what, because we need it. And if that's all you do, great. But if you wanna do more, just get involved and be active from where you are. For those of you who are parents, for example, think about the fact that when folks say, oh, we opening back up, let's go back to work. But what you gonna do when your kids don't have childcare or school to go to? So then you can't go back to work. So think about how you could advocate even with your school district to say, hey, we need actually some practices that are going to make it easy for my community to participate. So I would argue volunteer, participate, get active. You can join the NAACP. And if you don't like us, that's fine. Join somebody's organization. Do something with somebody's organization. Because at the end of the day, we really are fighting one by one, and our collective power is going to make a difference. And the last thing I'll say is if you haven't registered somebody to vote, talked about voting, and made elections a priority, now is the time to do so. The census is happening, and we're being undercounted. We're about 15% behind every other community. Reapportionment is getting started. Redistricting is going to happen at the end of the year. It's a whole lot of business as usual. And what happens is folks who have been in a pandemic, if you will, are now in this health pandemic. Our democracy is being manipulated underneath us. And so if we don't keep our eye on the prize and fight for the things that are happening to us existentially, we're going to lose in the end. So I say volunteer, volunteer, volunteer.
So Ford, if I could add just to Jamal's point about, if you are in a Black Greek letter organization, certainly I'll say to all my sorors and Delta Sigma Theta Sorority Incorporated, you know that social action are the origins of our sorority. And then that we certainly have been quite engaged and involved and active as it relates to, one, the COVID-19 pandemic. The sorority has been had hosted a series of webinars really to raise level of awareness and education about the disproportionate impact that COVID-19 is having on the Black community and communities of color at large, but also to mobilize and see that there's a lot that we can do in our local communities. The census is critically important. The census is important for so many things, including health, to get the resources and dollars to really fund critical programs, health and education and transportation. The list goes on and on. So really being involved and engaged. And there's so many ways when we talk about these policies and these structural inequities and systemic inequities, being involved is not only at the federal and national level, but it is critically at the local level as well, and whether it's through city council and local school boards, and ensuring that your voices are being heard to understand the impact of policies. Because while policy can help us to address and end inequities, there are also policies that actually create these inequities. And so having that voice and understanding how it will disproportionately and potentially negatively impact communities is critically important. And that's the voice that you can have. I also just wanted to come back to something, Sophia, that you mentioned, which is our mental health and well-being. And that is so important and something that needs to be underscored. This pandemic is certainly creating a great deal of stress and anxiety. There was a report that came out recently that said that about 1/3 of Americans are actually demonstrating signs of clinical anxiety and depression. And actually talking about mental health and well-being still remains something that, especially in the Black community, that we consider to be this taboo topic that we don't want to talk about. And yet it's critically important that we do, because there are these mental health crises, and mental health is part of our overall health and well-being. And so ensuring that, and you've likely heard a lot of people, especially in public health, who have said, it's not that we're socially distancing, we're physically distancing, because we want you to stay socially connected. That is so important. And so it's important to do things to not watch the news 24/7, because that can be very traumatic to see how devastating this pandemic can be. But maintaining those social connections, talking to people, and not being afraid to share. If you're feeling lonely, if you're feeling isolated, those are critically important. And recognizing that there is a lot of grief and trauma happening in the country, and that one of the things that we are advocating for at Trust for America's Health is really supporting and strengthening our mental health care system, because that too is a system that has been long underinvested in, and we are going to need a robust system that really can meet the needs, especially in a way that meets the needs of diverse communities, to address the collective trauma, but also the trauma that's happening in communities all across the country.
Thank you for that. And I'm so glad you brought back up the mental health piece of this, because you cannot have physical health without mental health. So I urge everyone to, at your own leisure, peruse the chat box, because there are a lot of excellent links to different resources in here that may be of interest to you. Another question: how does COVID-19 come to an end? I understand flattening the curve, but what else will move us forward? COVID-19 does not come to an end. The pandemic comes to an end, but COVID-19 will be yet another virus, just like the flu, that circulates throughout communities. What we hope is that as more people become exposed to it and it's less of a novel virus, that the effects of it will be less virulent. We'll have fewer people on ventilators, and it will become like influenza is now, just something unpleasant for most people to deal with. Though I remind folks constantly, hundreds of thousands of people die every year from influenza. And so it's nothing to be ignored, but we hope that at some point COVID gets to that point where we have a vaccine, where we have treatment modalities that people can use that will cut down on the severity of symptoms or prevent people from actually having to be hospitalized. But in terms of it going away, it's not going to go away. It will hopefully just come back a little less violent every year.
And I would lift up the thing that also doesn't go away is that we're entering a new normal. There are folks who are like, oh, we opening back up here in DC. The patios are open at restaurants. Business models are going to be forever changed. How we do policy and advocacy are going to be forever changed globally. You think about it, the US government found trillions of dollars to pump into the economy for the first time in our history. What does that mean in 2021? What does that mean in 2022? And so when we think about the notion of paying attention to what's happening around us, our healthcare system and our infrastructure, to what Dr. Gracia talked about, it has to change. Having a ventilator crisis or having a crisis where the mask that you need to prevent the spread of infectious disease is lacking means that we got to have a new normal. The real question is, what does that new normal look like for all of us? And so when we think about it from a business perspective or a healthcare perspective or from a political perspective, we're going to come out of this thing in a new reality. But some folks may not see it or realize it until it actually happens to them. So we're hoping that folks are really paying attention and reading the tea leaves around the fact that our country and the world is forever changed in this moment. But what does it mean for us? And how do we, you know, as one person said, if you're going to go through this hell, we got to come out and not be in the same hell that we started in. And so really making sure that we're doing our due diligence around asking critical questions. And the last thing I would leave on is I heard someone say, you know what? I realized that my company and my organization is saving money by having folks work from home. So why would we go back to an office? Actually, why don't we switch the economics model and have competition open up and have folks compete for these jobs globally? So when you start to hear those kind of conversations, you realize that the game has changed and the world has changed, and we have to really have our fingers and pulse on the moment so that Black folks aren't further left behind or cut out.
Thank you. Yes, and that's correct. I mean, I will speak for my own agency. When this first started and we had to close most of our offices, you know, the thought was, how are we going to deliver services? But it has taught us to be very thoughtful about using technology. There's so much medicine that can be practiced without actually laying a hand on an individual. And in some instances, some of us have been actually a little more efficient than we are in the office because there are less distractions. And so we will see more people teleworking. It's going to be a very interesting time. And we're going to have to learn to be more nimble on how we deliver business and services moving forward. Any additional questions? More great links coming up. Delisa's Surviving Homeschool. Soror Pam Ellis's COVID-19 and school. Lots and lots of TIFA, Trust for America's Health, COVID-19 and other advocacy resources, many census links. So don't miss this chat room. There's a lot of good information on here. Dr. Wiggins had a link, CompassionCollegeAdvisory.com, College in the Era of COVID-19, BusinessInsider.com, how New Zealand beat coronavirus testing and tracing. So again, lots of good resources. Any additional questions? Video on COVID-19 survival tips also on here on YouTube. So I will if there are no further questions, I'll let our awesome initiators of this great session. What a great idea. You know, it's so hard to squeeze time away in the midst of, I'm literally in crisis mode constantly. I just left a board meeting to come here, but this kind of information sharing is so important. I'm happy to see us represented by Alpha Phi Alpha. I'm glad my sorors stepped up and another awesome May week, but just very happy to have the opportunity to participate on the other side of things for a change. Thanks to Dr. Gracia and Jamal Watkins for your great comments and great information sharing. I enjoyed it. I hope everyone else did. I'll let either Seneca, are you closing us out, Seneca?
Morgan is.
Morgan is closing us out. Okay.
Yep.
Great job.
So yes, thank you again to all of our panelists. We see some applause, some muted applause that we're very grateful for. Thank you all for sharing your knowledge with us this evening, night, afternoon. We also thank you for the labor, the emotional, psychological labor that you continue to do in bringing voice to these issues and acting as very strong representatives for our communities in these matters, both in policy and just in the medical sphere generally. So thank you. So before we close, we just want to say a few quick acknowledgements to any current and former national and regional officers, committee and commission members through Delta Sigma Theta Sorority Incorporated. We're so grateful to have you all here joining us for our May week. We also would like to say a very special hello and welcome back to Okai to Soror Regina Wallace-Jones, the current mayor of East Palo Alto, as well as Soror Bessie Stewart Ross, the former president of San Francisco Peninsula Alumni Chapter, the amazing alumni chapter that does the advising and the close loving of Okai. So we're very grateful to see you both here tonight. And lastly, we want to thank all of the members of Delta Sigma Theta Sorority Incorporated, all the members of Alpha Phi Alpha Fraternity Incorporated, and all Greek affiliates that came out tonight to help support us and that came to learn and receive this knowledge with us. And just a final reminder that this is part of an emergency COVID-19 relief fundraiser for the students of Stanford University that's being sponsored through the Black Community Services Center, or for anybody who knows it's Black House, the Black House is the same thing as BCSC. And we will be having, I believe, 8 prizes that'll be going out tonight that will be reaching out to the winners. We have 2 gift cards and 6 large hand sanitizers. Get rid of all that bacteria in your life, maybe spray it on some door handles. If you got some kids, put it on anything they may look at because they're probably breathing on it too. But again, thank you all so much for coming out. We really do appreciate taking out the time to be with us, especially as the world is going through so much, and we all personally and within our own families and communities are going through so much. We'll have the recordings and the chats posted on YouTube soon. And again, thank you all so much.
Thanks so much, everybody. This was good mental health to see everybody.
Absolutely.